Thank you for turning to 10, your news leader. 10 News Conference with Gene Valicenti continues right now.
Welcome back. Richard Charest runs a lot of things in state government. He's the man running the Executive Office of Health and Human Services. Secretary Richard Charest in with us. Thanks. Your first time in with us today?
In the studio, yes.
Well, welcome in. Do you carry a fire extinguisher around with you? Because I looked at all the departments that you oversee, and a lot of them are troubled, right? We're not breaking news here.
Well, we have challenges.
Yeah, challenge is a good diplomatic way to put it. But really, it's like one fire after another. You must spend your whole day going from this department to that department to that department. I mean, is that a fair assessment?
So I don't know that that's a fair assessment. I would say that every department has times where they go through periods of difficulty, and we work to try and help them get ahead of that. We spend a fair amount of time, planning on developing a system that's better for Rhode Islanders, and that's largely what we're focused on today.
Right, but everything under you, it's in the news a lot. So maybe that's from my perspective, the hospitals, the state hospitals, the DCYF, and we can go on and on and on.
Sure.
Right?
Yeah. But we've had some significant accomplishments.
Okay, I'm going to let you talk about that too.
Okay.
I'll talk about this. Let's put a list up. Guys, put this up on the screen. You have the chunk of all the state action, basically. Department of Children, Youth, and Families, DCYF, the Child Welfare Agency, Department of Health, Department of Human Services, that's SNAP, we call them food stamps, things like that, all the attendant services that come along with that. Department of Behavioral Health Care, Developmental Disabilities and Hospitals, BUDA, right? And at the end, hospitals, right? That's a big chunk of it, not just one
and
word
Medicare,
over there.
And Medicaid.
And Medicare. Medicaid, rather. All right, where do you want to begin? DCYF. Wow, that's been a troubled agency since I got here 32 years ago. Can you get a handle on that?
Yeah, I think we can. There's a new director of DCYF, Ashley Deckert, and she's come in with a lot of energy and a lot of experience, and she's working on trying to address some of the long-standing issues that have been there. Largely what troubles, it's a difficult agency because of the nature of the work that they do, but largely they're working on developing alternative places that children can go when they're discharged from the hospital, into a more stabilized environment. And that's really what their focus is right now.
I should say, listen, the social workers over there, they're doing their job, and maybe they're overwhelmed. And they're not the ones harming children.
No.
Unfortunately, it falls on their plate. It hits the news. When a child dies, was that person in DCYF custody?
Right.
So you've heard the complaints. What marching orders did you / the governor give this person when they came in?
So she coincidentally was before advice and consent the very same week that I was before advice and consent for the secretary. So I was not involved in hiring her. She was already on board. But she and I work on a regular basis to address all of the issues that are coming before us and developing plans. Her recent state budget advocated some additional dollars so that we could advance alternative settings in the community for children to go into, more stabilized settings.
What marching orders have you given her? She reports up the chain to you.
So I surround myself with subject matter experts. So to my mind, she's the subject matter expert on DCYF, and I'm working with her on implementing her plan. So right now, her focus is on developing these alternative settings for children to be placed into.
Where do you want to go next? Want to go to the hospitals, the state hospitals?
Your pick.
You need new buildings, the whole new overhaul. What's your handle on that?
So I was actually called in as a consultant in 21 to help the state with Eleanor Slater Hospital, which had historically been thought of as the hospital of last resort. Actually, Eleanor Slater Hospital is certified as a long-term acute care hospital, an LTAC, which is a different type of acute care hospital, and it's the only one that Rhode Island has. Typically, an LTAC hospital will accept a patient out of an intensive care of an acute care hospital, whether it be Rhode Island Hospital or Kent. People that are on a ventilator that can't be weaned off the ventilator, they would go to that hospital. And so what we've been doing, we've been working to retool the hospital back to its LTAC function. And we're also looking at all of the other, we have a plan. We're going to segregate psychiatric care to the Cranston campus. We're going to leave behavioral health care in Burrillville. We're renovating the Reagan building now, so they will have a newly ligature-resistant facility for about 78 psychiatric patients in Cumberland. And we're going to build
just a new ligature. Is that what is that?
So we're building a building so that patients can't harm themselves.
Okay.
Based on the things within.
Well, you say ligature. That's hanging in layman's terms.
In layman's terms.
So these are safe units.
Correct.
That someone can't harm themselves.
That's right.
Okay.
Rather than having to walk around and make sure that everybody's safe every 5 minutes,
Okay.
we're building buildings that will be safe for patients who are obviously struggling to make sure that they're safe within the hospital environment.
Well, you've piqued my interest. I didn't know that that there is such a safe unit. What does that entail?
It entails looking at things like doorknobs, looking at the hinges, looking
Okay.
at the sink fixtures, looking at anything in the room that could be used that a patient could harm themselves on, the bed, everything.
Oh, that's interesting. And that would be new construction?
It's renovation. So the
Renovation.
Reagan building had been used as an acute care hospital. We're now retooling it to be a psychiatric hospital. And it's a $40 million renovation. It's underway now.
Right. Well, we're on the hospitals. This is your area.
It is.
You came up the ranks as a hospital administrator. Just give me a little background. You said born and raised in Woonsocket, and you were born in the hospital that you came to lead at some point. Give me the quick history.
Yeah, so I was born in Woonsocket Hospital then. It came together with Fogarty Hospital in 1988 as Landmark Medical Center. Back then, my undergraduate training is as a pharmacist, so I was the director of the consolidated pharmacies, eventually worked my way up into administration, and then appointed as CEO of Landmark when it was placed into bankruptcy in 2008. Took 5-6 years to get out of the bankruptcy, and then helped negotiate the deal with Prime. When Prime took over, I stayed on as CEO, and after 3 years, I retired the first time.
All right, so you're no stranger to the hospital.
I'm no stranger to the
This is your
hospital.
expertise. Also, you mentioned Medicare.
Yeah.
You're no stranger to that and the problems. Let's talk a little bit about that. Every doctor I know complains about the reimbursement.
Yeah.
Reimbursement rates.
So for the state, it's Medicaid. And
Medicaid, yeah.
Yeah, and so this past budget saw an increase for behavioral health providers, for children's service providers, as well as home and community-based providers.
Right.
We had $160 million in the budget to implement a rate increase for those providers, which hadn't been done for the last 10, 15 years. And so we have to go through every area to look at what they're getting paid and make adjustments so that they have a competitive rate, a market rate, so that we're not losing providers to Massachusetts or to other industries.
Let's just pause here and just talk a little bit about that. Medicare versus Medicaid. When I turn a certain age, I'm going on Medicare, which we all do.
That's right.
Income, it's not income-based, you go on it. Medicaid is income-based. The state handles that. That comes through you.
Correct.
Okay.
Yeah.
And the doctors complain about Medicare and Medicaid.
So we can help them with Medicaid. You know, one of the things that we're going to be focusing on is looking at what primary care physicians make.
Yeah.
That's been an area or a source of consternation, and we're going to be looking at that.
Right.
We've developed a large healthcare planning initiative. The governor issued an executive order back in February of '24, and we've developed a healthcare planning cabinet. I'm chairing that, and I have an independent advisory committee of subject matter experts that'll help us look at the entire system, which hasn't been done in quite some time. And reimbursement will be one of the things that we're looking at.
I want to talk about, this leads us nicely to a conversation about a shortage of doctors.
Yeah.
Shortage of doctors, shortage of dentists. You oversee the health department.
I do.
Maybe you have you still have a shortage of food inspectors there. That's a historic story I know all about. Stay with us. We'll be right back after this break. Welcome back. Richard Charest is with me. He runs the Executive Office of Health and Human Services. He's a secretary in Rhode Island. Your budget is about $3.5 billion.
So the consolidated budget for all of the agencies is about $6.3 billion.
What's the 3.5?
3.5 is probably Medicaid.
Okay, so all told, you're overseeing what number again? What figure?
6.3 billion.
That's the biggest budget. That's the biggest allotment for any state agency, right?
Yeah, it's 45% of the state's, about 44% of the state's budget.
So we have to have you in for a second part. You oversee 44% of the state's budget, and how many employees roughly?
Oh, I wish I could give you a number.
Hundreds.
Yeah, hundreds.
Hundreds.
Yeah.
We were talking about doctors and dentists before we left. There's a shortage in Rhode Island.
There
and
is.
This goes back to the complaining about Medicaid. I mean, a young doc is coming out. Who's going to advise them to set up shop in Rhode Island? You would say, go to Massachusetts, you make more, and you could live over there too.
Yeah. So that it's a problem that we're willing to address, and it needs a comprehensive approach, right? So some of the options that have been discussed are, looking at loan forgiveness programs so that when they're coming out, they don't have so much debt that they have to get ahead of so that they can be successful. We need to have more training capacity in the state to be able to produce more physicians. And we have to look at the salaries that they're making to make sure.
There's a move to open a new medical school at URI.
Yes.
And this goes into what you're saying. Well, okay, that's fine, but there's not enough ancillary training facilities to train those docs. Is that what you're saying?
So having a school is a wonderful thing. We would love to have a medical school that Rhode Islanders could apply to and get their academics from. But that has to be companioned with clinical training sites. And they have to go through several rotations: internal medicine, pediatrics, OBGYN, and psychiatry. So I think we have enough psychiatry and internal medicine capacity, but pediatrics and OBGYN is tough, right? Because we've got the existing medical school that's using those resources. So as we build that component of it, we would have to have additional training capacity so that the schools can meet those training obligations.
This is separate and apart from what Brown is doing with Lifespan at Rhode Island Hospital.
Right, so they're using, women and infants for their OB, they're using Hasbro for their pediatrics, and those slots are, probably full. And so as we bring in more students, we're gonna have to increase that capacity.
Right, talking to you, this is like a fire hose of information. And maybe I'm shooting you a fire hose of questions, but that's the nature of what you do. You oversee so many different agencies. We should mention, you're on the job 1 year. Okay, so
yes.
These fires were burning before you.
Some of them, yes.
Before you came in.
Yes.
Let's talk about DHS, which is another large agency unto itself.
It's a very large agency. We just successfully finished the return to normal. So during the pandemic, we were not allowed to do evaluation of Medicaid eligibility based on the different screens. And we just went through and reevaluated about 370,000 individuals to reevaluate them for their eligibility. And if they needed to transition, we would try to transition them to other sources of healthcare benefits.
Right, you oversee SNAP benefits.
I oversee SNAP benefits.
You oversee, which is, we used to call them food stamps. It's called SNAP now. You oversee all kinds of social services.
Right.
You don't oversee the homeless specifically as far as housing, but the homeless come to you.
They do, yeah. But I'll tell you, I'm very fortunate to have a tremendous staff that works with me. So Kim Brito, who's the director at DHS, she's wonderful. She makes sound decisions. She's always looking at the data, and she's always looking at ways to help improve operational efficiency. And she and I were meeting on a regular basis during the pandemic to make sure that all the processes were working well.
Right. With regard to DHS, they had the UHIP fiasco.
They had
predates you.
Predates me.
Everything's going well with that. Are the computers working?
So UHIP is operational and it's running smoothly. I mean, we still keep our Deloitte's feet to the fire. We just extended the contract during the pandemic so there wouldn't be any disruptions. That system's going to need to be upgraded, and so we're going to be going out for a request for information. The current contract, I think, ends in 26, and then we'll go out for RFP for another vendor to be able to help us upgrade that system.
Is your department too big? Should it be split up? Should you take certain agencies, another person takes other agencies?
So I will answer that by telling you that by having the ability to have cross-agency work done, when government works together and the silos are knocked down, it works very, very well. And let me just give you one example. We're about on October 1st to launch what's known as the CCBHC program, Certified Community Behavioral Health Clinic Program. This is a generational change to the way that we're going to run services for outpatient behavioral health. And so there's going to be, initially on October 1st, 8 certified community behavioral health clinics that are going to have to offer required services, and of those required services, it's going to require mobile crisis. A mobile crisis is different than what we're running now because the providers need to go to the patient.
Right.
All right. We have an example in the children's service, which we call MRSS, Mobile Response and Stabilization Service, where a provider will go to the child, whether they're at home, whether they're at school, wherever they are. And we've shown that there's a 90 to a 92% success rate keeping them out of the emergency department. So we're very excited about this massive change to an outpatient behavioral health program, and it could not have been done if all of the agencies did not work together. So the ability to choreograph the agencies working together and to knock down the silos and to facilitate that discussion is extremely helpful.
Well, I've taken a half an hour of your time. I'm going to let you get back to work. It sounds like you got a lot of things to do. By the way, you only work across the street in the Pastori Cup.
That's true.
You can walk back.
Yes.
Richard Charest, Secretary of Executive Office of Health and Human Services. Thanks for coming in. We just scratched the surface, but we'll have you back. Good luck.
Thank you.
Really. Thanks. Stay with us. We'll close the show.
Okay.
That's 10 News Conference. No, you must stay here till the end. That's 10 News Conference, your #1 longest running political show. Reminder, watch all of our interviews on turnto10.com. I'm Gene Valicenti. Have a great rest of your week. I'll see you on the radio Monday.